Okay, I will be presenting on the Positive Life Changes. It's a cognitive behavioral intervention for adolescents and young adults. It was developed by Nancy Guerra at the University of Illinois, Champaign-Urbana. Um, I'll begin with a brief introduction. It is a comprehensive, manualized cognitive behavioral intervention that focuses on 5 core competencies that are used to promote the healthy development of adolescents and also prevent multiple problem behaviors. It's targeted for a broad age range of ranging from age 13 to 25, and it's appropriate for all youth. Though the manual did mention that selection of youth can be targeted for those youth who exhibit problem behaviors. It can be administered in a group, it's meant to be administered in a group-based setting, and can be done in a school or an alternative setting such as a community-based organization or program. Some details about the protocol is it includes a leader's manual, which has lesson plans for each of the sessions that are covered in the program. And the participants use 3 workbooks that accompany the leader's manual during the sessions. And each workbook accounts for 10 sessions. And each session is meant to be about an hour long. It assumes the use of 7 skills that the group members would be implementing or carrying out throughout the sessions, and those include maintaining confidentiality, listening, participating, staying motivated, and things of that nature. It's very flexible in terms of the implementation according to the leader's manual. It can be implemented using all 3 workbooks, and if they recommend if you do it that way, that you do so in the sequence in which they're followed, workbook 1, 2, and 3. But it also says you can exclude certain modules that may not be appropriate or relevant to the group you're conducting this protocol with, and you can also adapt it to use in an individual-based setting, or make arrangements in terms of reading and writing ability, because it does incorporate a lot of reading and writing. So it did mention you can be pretty flexible with the implementation. It does have a present and future focus, where it focuses a lot on current things that are going on with the adolescents at the moment, as well as future goals and directions, and also places an emphasis on teaching social cognitive skills, the core competencies, which I'll describe more in detail later, and it also incorporates mindfulness strategies. These are the 5 core competencies that make up this protocol. They use a competency-based approach that includes these 5 competencies, and they are all interconnected. These include self-control, positive sense of self, decision-making, pro-social connectedness, and a moral system of belief. And just to describe a little bit more of what these are, positive sense of self specifically includes things such as self-awareness and self-esteem. Self-control includes things like emotion and behavior regulation. Decision-making is pretty straightforward. It involves decision-making as well as problem-solving ability. Moral system of belief concerns itself with fairness and justice and the welfare of others. And pro-social connectedness relates to the sense of belonging to among the youth, and in terms of belonging to a group where they have a sense of being acknowledged and cared for within a particular context. One thing I did want to mention about those core competencies, they represent key social and emotional learning skills that increase the healthy adjustment of adolescents and also decrease the chance of problem behaviors such as violence, substance use, and risky sexual behavior. There's a recent meta-analysis done by Weisberg and Durlak on social-emotional learning, and showing that social-emotional learning programs significantly improve social and emotional skills, behavior, attitudes, as well as academic performance. In regards to the theoretical foundation, this protocol uses a strengths-based approach in its theoretical foundation, and implements a positive youth development. So it places an emphasis on PYD, or positive youth development, and it's based on the premise that youth will behave more responsibly if they understand their strengths, know how to access social support, learn to set positive goals for themselves, understand the consequences of their actions, and effectively resolve conflict and daily problems. We continue with the theoretical foundation, the focus on the prevention of problem behaviors through developing skills that pertain to the core competencies. Other meta-analyses and reviews have shown that cognitive behavioral interventions are most effective at reducing or at preventing problem behaviors among adolescents and young adults. Additionally, it incorporates mindfulness-based strategies, and mindfulness-based cognitive behavioral treatment has been shown to reduce stress, as well as teach youth how to deal with anger and their negative emotions in a more constructive manner. So we'll get into the specifics of the workbooks and the sessions that are covered in this protocol. Workbook 1 is called Who Am I and Where Am I Going? And it places an emphasis on a positive sense of self, on self-control, on the assessment of the strengths, building upon those strengths, identification of those strengths, and capitalizing on those strengths, and also introduces mindfulness. In regards to the core competencies, all 5 core competencies are integrated throughout all 3 workbooks to some degree or another. So you'll see some of those standing out in some workbooks more than the other, but they're incorporated in there. Specifically, positive sense of self refers to things like self-esteem, self-awareness, self-efficacy, and sense of purpose. Self-control relates to proactive control, like willpower,